Hi, my name is Kelly Kirby. I work at the University of Iowa in the Radiation Sciences Student Affairs Office. I want to talk to you today about the many career options in the realm of radiation sciences. People that work in the radiation sciences use patient care skills, they create medical images, they image and are able to evaluate anatomy and the physiology of the human body, and mostly it is technology based. Some examples of careers in the radiation sciences are radiologic technologists, radiation therapists, and sonographers. They are the people that perform the imaging exams. So they use radiation, sound waves for sonographers, and medical imaging equipment for MRI technologists. They prepare and position patients, hopefully using excellent patient care skills. So if you've ever had any imaging done, this was the person that came and got you from the waiting area and helped explain the exam and hopefully helped to get you through it with ease. They always practice radiation safety. And I just want to bring up a radiologist in comparison to a technologist, a radiation therapist, or a sonographer, because we're going to talk more specifically about those three that I just mentioned. But sometimes a radiologist gets confused with what the technologist or therapist or sonographer does. So specifically, just so you have that understanding, a radiologist is an actual physician who specializes in the diagnosis and treatment of patients using imaging equipment. So they're the people that are actually interpreting the images that are produced by those technologists and sonographers. So they are a medical doctor. They've gone to 4 years of undergrad, they've gone to 4 years of medical school, and then done a residency in radiology specifically. So a lot more schooling, and they're the person that's interpreting the images, not as much hands-on patient care as, say, that technologist or sonographer or therapist. I just want to clear that up because sometimes they get intertwined. Okay, so we're going to break down all of the different career options. Radiologic technology or radiography, they're RTs. These are people that use x-rays to produce images of the body for diagnosis. So this is an example of one of our former students setting this child up for a chest x-ray. This is an example of what a chest x-ray would look like if they had taken one in this example. So radiologic technologists work in diagnostic imaging, or it's called diagnostic imaging, so they can work in the general area, which is mostly adult care, in peds, in musculoskeletal to focus on the joints and bones of the arms, legs, and basically the extremities. And then mammography, which I'm going to talk specifically about in a little bit. They use fluoroscopy, which is live x-rays. They go on portable imaging. Some of our patients are very sick and they are unable to come to our department, so we take a portable machine up to them. There's also the emergency room setting. Maybe some of you have had to go into the ER and have some imaging done, so those technologists work in there, as well as the operating room. So many surgeries have assistance from imaging. Gabe is one of our radiologic technologists here at UIHC, and he's going to talk to you a little more about his job specifically.
Hello, my name is Gabe Decker. I am a radiologic technologist here at University of Iowa Hospitals and Clinics. Right now, my current role is the assistant manager for general radiology. What that encompasses is basically anybody who needs to go to the ER or the OR, portables, inpatients, outpatients. We do it all, but mostly on adults. We do have a children's hospital that does all the ped stuff. I've been doing this for over 13 years now. I went to community college in Indian Hills in Ottumwa and got a job here right after that. It's a great profession. I recommend it to anybody, male or female. It's a great way to meet a lot of different people. You work with a lot of different people. You work with students a lot. That's pretty fun. You get to try to educate the future of this profession. The patients are always great. Some are in a lot worse off or, more painful condition than a lot of others. So there's a lot of times where we have to get creative on how we do the job, which is pretty much another one of the fun parts. Is not any one person is the same, so there's always a different set of challenges that we have to overcome. But at the end of the day, we just pretty much take care of our patients, and we just try to work together as a team to get the job done. Well, here we have a phantom patient that we could take an x-ray on this table here, just to show you how it's done. Your x-rays are going to be coming out of here, which we call the tube, the x-ray tube, down here to your detector. The tables are made to move around, so you can move patients pretty easily. And right now we're centered right over the pelvis. So now we will take the x-ray.
So breast imaging is a specialty modality that radiologic technologists can either be cross-trained in and then sit for a board exam. They can learn specifically about breast imaging. So it's imaging and procedures of breast tissue, and they use x-rays, they use MRI, they used breast ultrasound, and this is all for breast health. Bridget was nice enough to share with you guys a little bit about her job in mammography.
Hi, my name's Bridget. I work here at the University of Iowa in the breast imaging department. I'm a specialized care coordinator. I have been doing breast imaging specifically since 2013. Prior to that, I did general radiology, so I grew into this position. Here over in the department, I do mammography. I take the mammograms, I do procedures, and I also do breast ultrasound. I did go to Kirkwood myself also, so that kind of helped get me to where I am today. I did 2 years at Kirkwood and then went to Covenant School of Radiology. I very much enjoy what I do here in breast imaging. I love being with all the people. I'm a big people person. I can talk to just about anybody, so I love helping them get through their exam and making sure that they know that everything is going to be okay. My favorite part about the job, I would say, is seeing reoccurrent patients. I know that that is not their favorite thing, but it's pretty welcoming to them to get to see us day in and day out every time that they have to come here for an exam. The challenges would be doing the actual biopsies and procedures and giving results. Doing ultrasound, especially, patients often look to us before the doctor comes in to see, kind of what we're thinking about what we're seeing on the exam, and then definitely doing the procedures and the biopsies. Lots of people can feel very uncomfortable and unsteady having exams done. So definitely I would say that part of it. But I'm able to kind of put a spin on it and talk them through it and make them feel like they're okay here.
Cardiovascular interventional is the next imaging modality radiologic technologists can specialize in. In CVI, a technologist uses x-rays to create images of either the heart or any of the vascular systems. A sterile technique is used to assist a radiologist or a cardiologist to evaluate vessels in the body. So specifically at UIHC, our technologists either work in the cardiac cath lab or in the vascular lab. Stephanie is going to speak with you about what it's like to work in cardiovascular interventional.
Hi, my name is Stephanie Coleman, and I work in interventional radiology. Most people don't have much of an idea of what that is, so I'll give you a little bit of a spiel. If you've ever heard of anybody having an angiogram or a heart cath, we do that here. So if somebody has a bleed in their abdomen, we would go in and treat that through the arteries in their body. We also place IVC filters. I did all of my training here at the University Hospital and have loved it. One of the things that interested me so much in this department is that you get to work directly with the physicians and the nurses, and then of course the patient. And your patient care actually tends to be a little bit longer with them here. An average procedure is about an hour on and off the table, and we use nurses to give the patient sedation to make them comfortable. And as a technologist, what we do is bring the patient into the room, get them on this table. This is our C-arm. This is what we use to x-ray during the procedure so that we can see everything we're doing. And then once we get them comfortable, we prep them. So we get use sterile techniques to get them prepped on the table. When they come in, we will clean whatever area we're working on, their groin or their arm. And then when the doctors come in, they will scrub in and we give them the equipment that they need for the procedures. For example, this right here is a stent that would be placed inside of a patient's body. This one is big enough it probably would be in the iliac artery in the groin. We also have things like the IDC filter. So this would go into a patient's inferior vena cava and it would sit about like this in order to keep clot from going to the patient's lungs. So we also have coils, and what those do, if somebody's bleeding internally, we can go in and find the bleed and put coils into that area in order to stop the bleeding. It's a very fun job. What I love about it is even if you're doing something that's the same, it's different on everybody. So working directly with the physicians and the nurses and having more time with the patients are the things that I love about this job. And you know, some of the challenges that come with this is that most of the time people don't really know what interventional radiology is. So trying to recruit people to this department can be challenging until you come in and see it and love it. After that, you're pretty much hooked, at least if you are like me.
Next, we have computed tomography, or CT for short. In CT, X-rays are used to produce cross-sectional images of the body. It's a very high volume area. You can image the body very quickly. You can scan any part of the body from head to toe in a very short amount of time. All body parts can be scanned. You can see this is what a scanner actually looks like, and this is an actual cross-section of an abdominal cavity. So you can see liver, gallbladder, pancreas, stomach, spleen, the thoracic spine, kidneys. And then this is a 3D reconstruction of that similar area. Yvonne is going to share with us his experiences of working in CT.
So my path to choosing this career involved really getting to know my personality traits, my values, and my interests. So I actually did that with the assistance of the Career Center and took some surveys, and they kind of assisted me in giving me some options of what career might be the right fit for me, and I just kind of took those and researched them on my own a little bit better, and I came across the description for radiation sciences, which is a major offered at the University of Iowa. And when I read the description, I think I jumped out of my chair. I was so excited, and I just had a feeling that this was the career for me. So from there, I just focused on scheduling job shadows, volunteering at the hospital, taking health-related classes, and through all of those experiences, it reaffirmed for me that I really saw myself in this career. So it's history from there. One of the reasons I picked CT is because there's very high demand for the radiology department in general, but CT, I feel like it is very involved with numerous specialties, so you are able to be you're able to contribute and be very well-rounded about different pathologies, like I mentioned, in numerous ages, from pediatrics to geriatric population. So that's one thing that excited me, is that there was a broad range of different specialties that you could contribute and make an impact. I really like working under pressure, which you will find yourself in those circumstances working in CT. Challenges are definitely time management, being efficient, tuning out the distractions, like I said, being focused, stay concentrated. Okay, so this is what a CT scanner looks like. It's very often confused with MRI. They look very similar, but function completely different. Our scanner uses X-rays to produce an image. So within this gantry, we have a X-ray tube and detectors that kind of rotate and sync and help us produce an image. So our patient population can vary from infant age through geriatric population. We can complete exam from head to toe, and for numerous organ systems, skeletal, nervous, vascular, numerous specialties that we're involved in. Some of them are pretty simple. They can take 5 minutes or less. The most time-consuming thing can be positioning, just getting the patient in the right position. Okay, so in continuation with having our patient positioned, we are ready to scan. One of the first pictures that we take is called a topogram, and the purpose of that is to set our scan range and also identify any objects that might affect the quality of our CT scan image. So right now we have a demonstration of a head CT. So this is my scout image, or also referred as the topogram. My job here is to position the patient by centering them to our scanner, either by raising the table up or down, and then setting my scan range. And this box here, this pink box, demonstrates or would be called my field of view or scan range. Once my scan range is set up, I make a note that we're not using any contrast, and we are ready to scan. Just always be aware of what your patient is doing while they're in the exam room. If they are in a position for you to be ready to scan, you go ahead and proceed. So the scanner has finished exposing, and this is typically what your X-ray images will look like when you scroll through. I'm scrolling through sliced images of a head CT scan.
MRI, or magnetic resonance imaging, uses a magnetic field and radio waves to produce cross-sectional images. So sometimes CT and MRI gets interchanged from a layperson's perspective, because both exams, the patient goes into a tube kind of machine, and cross-sectional images are produced. MRI does not use X-rays. Like I said, it uses a magnetic field and radio waves to produce their images. It doesn't use X-ray, but there are many magnet and those radio frequency safety components that do take place. Cody is nice enough to share his knowledge about MRI and what it's like to be an MRI technologist.
All right, my name is Cody Frank. I'm an MRI technologist at the University of Iowa Hospitals and Clinics. Kind of what the MRI technologist consists of is we're the operators of the MRI machines. We take pictures of any part of the body besides lung fields, basically. MRIs are capable here at 1.5 Tesla and 3 Tesla, which are different strengths of the magnet, 3 Tesla being the higher one. An average typical day of an MRI technologist consists of kind of checking over the patient's screening form, which is a form that goes through all the implants of what the patient could have inside of them. Anything that's not MRI safe or that needs reviewed, we'll make sure it's safe before we get the patient inside the scanner. And then what is consistent of an MRI is what we kind of go through is it's a very loud machine. You're going to hear a lot of loud banging noises, kind of like a construction zone. That's caused by the inside of the magnet is full of coils or a gradient scale, which is vibrating due to the electric frequency going through them. Kind of a demonstration of the magnetic field is this is a block of aluminum. So it's paramagnetic, so it kind of interacts with the magnetic field, but isn't fully attracted to it like a ferromagnetic would be. So pushing it over, you can see how it's kind of interacting with the magnetic field but not being sucked in. Whereas normally, this is a very heavy block, should just fall over. Different areas that we cover are neuro, body, pediatrics, cardiovascular, MSK, almost anything, and then there's also a whole research department here at the U that we provide a bunch of different services for. Typical day here at the University of Iowa, I work first shift, so I'm 7 to 3:30. We cover the patients going from the main hospital, the children's hospital. This is their sports med facility, but as of right now, we do not cover any research. That's kind of their own crew over there. Got me into MRI was actually going in through the X-ray program. Me and one of my buddies, he was also in the program, did a lot of research going through it. I didn't like the sound of radiation, and I chose the radiation program, I don't know why. But MRI is actually non-ionizing radiation, so there's no long-term harmful effects. Even though we're fully protected in the other modalities, this was kind of more interesting to me. I also love that the capability of changing all the parameters on the machine selection to me was really interesting. Going into, let's say, X-ray, a lot of stuff set up for you. Here, we're dealing with a 30 to 40 minute long patient test, and a lot of people can't handle that holding still. Even laying down, if you have a hurt spine, it's going to be very uncomfortable. We can actually adjust our parameters to kind of help eliminate some of the motion in the sequences. We can cut down the timing of sequences. You can also call the doctor and see if there's anything that we have to eliminate, so we can take away some of the sequences. And to me, compared to X-ray or CT, it's a lot more involved with the scanning technical aspects. And then there's a whole different science background, a lot of physics to go into MRI. I think the people at MRI are amazing. I think dealing with the patients is always a fun experience. It's a longer exam, so we kind of joke around with them, kind of get to know them to an extent. I actually really enjoy my favorite exam. It's called the multiple myeloma. So we scan the head, shoulders, sternum, spine, pelvis, kind of work your way through the entire body, and you're kind of involved the whole time. I also love working at the children's hospital, kind of learning how to deal with a pediatric patient and getting them excited for an MRI is kind of a fun, rewarding experience. You always have those patients who are really scared of it, telling them this is going to be a rocket ship and they're going to be zooming on through, gets them in a fun imagination, and they can usually do it pretty good. Also, at Children's Hospital, we offer Netflix. So.
How about any challenges in this career?
Ooh, challenges. Lots of challenges, especially with MRI. Technical challenges are you're dealing, like I said, with the patient's comfort levels, different needs. Some people are very kyphotic, and our tables don't magically raise up, so we have to figure out kind of technologically how can we get enough signal around their head to get good pictures for the radiologist. MRIs is basically, think of it as radio signal. You're going to be getting antennas around them, building up signal so we can have good image quality. Further away they are from the coil, which this table actually is a coil, the less signal you have, the more static you'll see, kind of the graininess on the picture. So working through different mechanisms to increase your signal to the patient and keeping the patient happy and comfortable is probably the biggest challenge. Other challenges are learning the vast array of exams. Kind of the top tier exam that we do is a cardiac MRI. You have to learn all the chambers of the heart, all the arteries going out of it, how to correctly acquire those. Fun thing about hearts is they're non-stop pumping, and MRI is very sensitive to motion. So how do you image something that's non-stop moving? You have them hold their breath, and you image when the heart's not beating. So hooking up patches, making them hold their breath, and acquiring the images appropriately while they're doing that is kind of a fun thing to do. It's by far the most challenging one, and it's probably one of my favorites as well, just because there's a lot that you have to learn to go into it. It's kind of like the end level exam. There's not much more, I guess, that you can know beyond that kind of final term.
What would you give as suggestions for anybody that's thinking about going into X-ray or MRI specifically?
Make sure you love it. I mean, when you're going into an X-ray or MRI, I'm glad I chose what I did. The, like I said, technological aspect of it really drew me in. going through X-ray, I really enjoyed like the didactic part of it. And fluoroscopy is, if I could choose to be somewhere the whole time, either be fluoro or I also love the OR, just because you're kind of more in depth involved with people's plannings. MRI, like the first thing that got me was the images. They just look so much different, and to me, more clear than every other modality. I actually love looking at pictures still to this day, 4 years in. Other things you want to consider is knowing that you're going to have to be learning in depth, not just the scans, but physics behind it, knowing all the material for it. So if you don't love it, make sure you figure out what one you enjoy the most. All right, one other fun experiment we like to do is kind of show ferromagnetic properties. There's actually a little metal band here on our surgical masks. Kind of clip it around your nose. And the strongest point of magnet is the isocenter, which is way in the center there, which is where we get our pictures. So unlike this one, which wasn't pulled, a ferromagnetic property will get pulled directly into the isocenter. And then as you get out, you see that it's weaker. And if you do let go, it gets sucked straight in.
Diagnostic medical sonography, or ultrasound, as a lot of people call it. It uses high frequency sound waves, and you can create images of many organs in the body and blood vessels. Many people think of OB, but the entire body, almost basically everything but the lungs, can be imaged in sonography. It's a different type of exam because of the extended patient care contact. As you can see, this is a sonographer, and this is how close they are to their patient. So they actually have to have the transducer on the body part of interest. So you're up close and talking to your patient for a good 30-45 minutes to get the exam. This is an example of a kidney. Megan is going to share her experiences today, what it's like to be a sonographer.
Hi, my name is Megan Lyons. I work in radiology ultrasound at the University of Iowa Hospitals and Clinics. My specialty is abdominal ultrasound, and I'll tell you a little bit about how I got here. So I came here in 2012 from the University of Iowa, and I was in the radiologic technology program first, which at that time was taking x-rays. And so I did that and completed that program, and then I worked as an x-ray tech for 2 years while I was in ultrasound school. And so what we do is we use diagnostic ultrasound to take pictures of the organs all throughout the body. So what I specialize in is the abdominal cavity right here. So I look at livers and kidneys and the gallbladder. We do thyroids, things like that. We do renal transplants, liver transplants. We also do a number of procedures in the thorax, abdomen area. And so when you go through ultrasound school, you learn OB-GYN, vascular, possibly cardiac, which is an echo of the heart, and then abdominal ultrasound imaging. And if you work at a larger hospital, that's usually specialized into different categories. So my main focus is abdominal. I also do some OB-GYN and vascular scanning in the evenings and on call, but mostly I do abdominal. My favorite thing about my job is the patient interaction. So what's special about ultrasound is we are with our patients for a longer period of time. As somebody who took x-rays, and now I obviously am a diagnostic medical sonographer, that's my title. You spend a lot longer with your patients, between 30 minutes to an hour. So I love that patient interaction. You get to know them really well. I also love just the field of ultrasound itself. It's very different from other imaging modalities in that if my eyes don't see it, then the radiologist is never aware that there's pathology. So it's a very challenging and difficult job, but that's what makes it so great. You're always learning and you never stop learning. To be in this field just takes really good communication skills. Obviously you need to study hard to learn all of the anatomy and physiology that's involved in ultrasound. That's the main basis of our job, is anatomy and physiology. So I'm scanning a liver at this moment. I'm in the left lobe of the liver, so I'll just do a quick anatomy sweep here. This is the left portal vein. The portal system is the main blood supply to the liver. This is her IVC, the caudate lobe of the liver, and then this big black structure is the aorta. On ultrasound, the different grays represent different tissue stiffness from the ultrasound beam. So the grays Here, that's the liver. The black is blood vessels, so fluid shows up as black on ultrasound. And then this is the heart. You can see that moving there. So ultrasound is live all the time. So I'm just scanning through. That was the heart and then the liver.
Second to last, we have nuclear medicine and PET. Nuclear medicine and PET technologists use large cameras to detect radioactive pharmaceuticals that have been injected into the patient. They produce images that help us review the functionality or the physiology of different organs. Tim is going to share what it's like to be a nuclear medicine technologist with you.
Hi, my name is Tim Weddle. I am a nuclear medicine technologist here at the University of Iowa Hospital. I've been doing this for about 10 years. As far as what we do in nuclear medicine is we do imaging of bodily functions, so physiology, how the body works. We're different from traditional x-ray because we actually inject the patient with radioactive liquid. So instead of our camera being the source of radiation, the patient is actually the source of radiation. And our cameras is just the film that detects that radiation. So what does bodily function imaging entail? Well, depending on what organ we're looking at, we can inject you with a liquid that is specifically designed to go to that organ so that we can image if it's normal or not. So, if you're having gallbladder pain, right upper quadrant pain, we want to take a look to see if the gallbladder is functioning. We can inject you with an imaging tracer. It goes to that biliary system, shows us if that gallbladder is now working properly or not. Okay. If they're questioning if you have blood clot to the lungs, then we will have you actually inhale some radioactive oxygen. We can then image your lungs there to see if your lungs are getting properly aerated. We can also give you an injection to see the blood flow to the lungs and make sure there's no blockages to the lungs. We also do things where we can look at the emptying of the stomach there if you're having problems with digesting your foods. We then put a little bit of radioactivity in eggs, have you eat the eggs which are radioactive, and we can take pictures of that emptying. Some of the other things that we do in nuclear medicine is we do therapies for cancer patients. Either we can image to see if therapies are effective or not. We can image to see if you've had recurrence of cancer or not. Also, we can, again, give you therapies for a certain amount of cancers. We also do a lot of research studies, which that's a whole another deal in and of itself. But how did I get interested in nuclear medicine? Well, I started out at Kirkwood, and in Kirkwood I partnered up with Mercy St. Luke's School of Radiology and got my associate's degree for the RadTech program. During that program, I was exposed to certain different specialties, so from CT to MRI to nuclear medicine, and I fell in love with nuclear medicine and CT. So once I graduated from Kirkwood, I worked, cross-trained in CT, and then I came here to the university for nuclear medicine, and I've been here ever since. You really can't tell what you like until you actually get exposed to them. So I would encourage any of you, if you're thinking about it, go ahead and job shadow. Come see us. Come see us. All the different programs here at the university are excellent. Patients that we interact with here at the university, we interact from anywhere from infants all the way up to the elderly, which is very unique for the University of Iowa Hospital. Most hospitals you'll deal with young adults to older folks, but we very rarely do any kids. But here, because we are the only level 1 trauma hospital, we do everything. So if you come and train with us here, you will be ready for any place that you go out to work to. What do I love most about my job is the patient interaction. I love taking care of patients. I love that in nuke specific, we're more involved. So the stuff that I do, I actually feel like it's making a difference. We have a lot of science behind what we do. We are counted on by our physicians to know what we're doing. They ask us our opinion all the time on what we think is going on with the patient. So when you come here, you're going to get a quality education, and you're going to be counted on to actually help some of the physicians with figuring out what's actually going on with that patient, especially if you go somewhere outside of the university to work. The challenges is just that you are going to be counted on to know what you're doing. So when you come here, it's important to be able to really learn what's going on, not just from a technical aspect, not just knowing how to take pictures, but you need to know a little bit about pathos. You need to know a little bit about diagnosing things of that nature, because a lot of our stuff is not only timed, but we have to know what happens if certain things go a different way. And you have to know, because it's time, you have to know on the fly what to do next. And then also, because doctors will count on you to know those diagnoses, you just have to know what you're doing.
And lastly, radiation therapy. So radiation therapy is lumped in with the radiation sciences because in radiation therapy they use high doses of radiation. They're the only group that strictly is a therapy. All of the other items that we talked about help in the diagnosis of the patient typically, so they're considered diagnostic imaging. We're helping the patient discover what's wrong so they can make a plan to hopefully get themselves better. In radiation therapy, we know what's wrong with the patient. It's almost always cancer, and so x-rays, high doses of x-rays are used to produce a treatment to hopefully kill those cancer cells. So high powered radiation will hopefully shrink the tumor in a patient. And Mallory is going to talk to you about what it's like to be a radiation therapist.
Hello, my name is Mallory. I'm a radiation therapist. What I do is treat people with cancer, and these machines here produce radiation that localize to the patient's cancer cells to kill their cancer. The reason why I love being a radiation therapist is because I get to know my patients. So the majority of them come for treatments every day, Monday through Friday, from a range of 5 to 35 days. So I get to see them every day for about 15 minutes. I get to know them and their personalities. So that's the main thing I love about being a radiation therapist, is getting to know my patients. There are challenges. Obviously, I don't work with the healthiest group of people, but I love that I'm being a part of their resolution and trying to get better in treating their cancer. So it's not like every day we have healthy patients. You know, you see a lot of tough things and people almost at their worst times in their life. So I would say that's the biggest challenge, is trying to help them get through that. So I decided to become a radiation therapist. First, when I got to college, I knew I wanted to do something in the medical field, but I wasn't sure what. I knew, like I said before, I wanted to be part of somebody's treatment instead of diagnosing, and I just started researching things in radiology, and I just came across radiation therapy, and I was interested in like physical therapy, but I didn't want to go to school for that long. And then once I saw radiation therapy, I decided to research that more because I didn't know a whole lot about it. And then I decided to job shadow, and then after that, I was like, okay, this is definitely what I want to do. Typical day of treatment, we'll get them laying down on this table, and they're in the same position each and every day. And they will have some marks on their skin. So what we do is we use these lasers. We move the table. Move the table to line them up on their skin. We position their bodies so they're correctly turned and straightened in the same position every day. This machine can rotate around them. So this machine rotates 365 degrees. We use this machine to first take an image for patient's treatment each day, and then after that, this machine will deliver the radiation.
Okay, so if this is something that's interesting to you, how are you going to prepare yourself? You, in high school, you can take math, science, any physics, anatomy and physiology or biology classes. Getting some healthcare experience, so volunteering at a hospital or a clinic or a nursing home. Complete a CNA course or work as a CNA or some sort of nursing assistant. And then job shadowing. Unfortunately, at this time, we aren't allowing job shadows in the hospital because of COVID-19. However, hopefully someday we will be back to allowing job shadowing. So shadowing a technologist, a sonographer, a radiation therapist in various settings, whether it be here at UIHC or at a local hospital or a clinic that you have access to. That's really going to help you get a feeling of what what it looks like day to day for a therapist, a technologist, or sonographer. And then just researching the field. You can get online. There's thousands of websites, YouTube videos you can look up. And then anybody that you would know that does this. So personal interviews, ask them what they like, what are the challenges of their job, would they recommend it? Really important to really research what you're going to potentially get into. Here specifically at the University of Iowa, our degree requirements, depending on which route you would want to go, there's 1 to 2 years of college prerequisite courses. Those include rhetoric. So if you're taking things at Kirkwood or community college, that's usually Comp 1, Comp 2, and a speech class. Anatomy, physiology, human anatomy I should say, physiology. If you're interested in radiation therapy, sonography, or nuclear medicine technology, you would also need a physics class. If you're thinking about nuclear medicine, you will also need a chemistry class. Elementary psych, medical terminology, and then a pre-calculus level of math, and then 2 general education courses. So those are all prerequisite courses. Our programs are competitive and selective, so you need to have all of these prerequisites either completed or in progress when you would apply to get into our programs. So 3-year professional programs are the RT-CT, RT-MRI, RT-CVI, RT-BI. So the RT, if you go back, that's the radiologic technology. Everyone that starts in a class, they're going to take their first 2 years of classes as an RT program. And then their senior year, their 3rd year, then that's when they would specialize in either CT, MRI, cardiovascular, interventional, or breast imaging. For the sonography students, there's 2 different tracks. So there's general and vascular. So they learn basically everything but the heart and the vascular system. And then there's a cardiac track where they learn the heart and the vascular system. So this is where job shadowing is really important, because you're going to have to decipher the difference between all of these when you're applying to kind of determine what you want to do. 2-year professional programs include that radiation therapy program and the nuclear medicine. Nuclear medicine has their own degree, but we talk about them because they are in that radiation sciences realm as well. Okay, so what are outlooks? Outlooks and salaries, radiologic technologist, faster than average growth. This was back September of 2019, so less than a year ago. Diagnostic medical sonographers, much faster projected. Radiation therapist, faster than average, and so is nuclear medicine. So there's a great need for all of these healthcare careers. So that's really important when you're looking at what career field you're interested in. Make sure there's going to be jobs out there for you. Different career options for people that become radiologic technologists, staff technologists in sonographer and radiation therapy. That's usually your first job out the gate. But there are many items or many ways to kind of change paths without starting all the way over. Advanced degrees in dosimetry, that's for radiation therapists. Master's degrees, some of our students go on to be physician's assistants, MDs, or DOs. There's sales. Equipment companies love to hire radiologic technologists or sonographers or therapists because they've actually used the equipment. And so when they need to go into other hospitals and do trainings and things like that, they're really great application specialists because they know the anatomy, they know how to deal with patients, and they can really talk to the people that are using the equipment because they've done it themselves. There's professional involvement. Political, you could be exam writer, accreditation surveyor. There's always research and development. You can go in administration, so become a supervisor or manager, chief technologist, or clinical administrator someday. And then education, that's my realm now. So clinical instructor, clinical coordinator, or program director. So there's a lot of different paths that start with that radiation sciences profession. If you would ever have more questions about this degree or just becoming, getting into the radiation sciences world, we'd love to talk to you here at the Radiation Sciences Student Affairs Office. Jenny Myers, myself, Kelly Kirby, or Hannah Kelly, be very happy to speak with you. Thanks so much for listening. Have a great day.